Director Reese, you're muted.
Works better if I unmute myself. Good afternoon, everyone. This is Andy Reese, Director of the Department on Disability Services. Welcome. I'll review our data. One thing I'll let you know up front, unfortunately, DC Health is having an all-staff meeting today, which conflicts with this. And so, unfortunately, none of the staff who typically join us from DC Health will be with us today. There was some new guidance issued by DC Health this week regarding visitation in intermediate care facilities, and I am going to review that guidance in this meeting and hopefully be able to respond to questions people have. If there are additional questions, DC Health will respond to those next Friday. So as of today, there have been 258 people supported by DDS who have tested positive for coronavirus. That was an increase this week of 2. We have 3 people now who are in the hospital, unfortunately. We also have had 34 people who have been diagnosed with coronavirus who have died. Of those, 2, we have confirmation from OCME that those deaths were not caused by coronavirus. And we actually now have 5 people who had recovered from coronavirus and subsequently died, in addition to those 2 that do not count as coronavirus deaths. And so we are still awaiting a final determination from the Office of the Chief Medical Examiner regarding those other 5 deaths, including the one that just occurred yesterday. There were 139 people, and I'm sorry, I should have reduced that by 138 people who required no inpatient care. I'm only changing it because the total comes up to 258, and the person who died had not required inpatient care. And 82 people who did require inpatient care and had been subsequently discharged from the hospital. In terms of placement type, we have had 4 people in host homes who have contracted coronavirus, 86 in intermediate care facilities, 25 in natural homes, 2 in a nursing home, 27 in a host home, and 114 who were in supported living. For people who are tracking this week to week and notice a discrepancy, there is a person who I had listed as being in a natural home who actually moved right around the time they were diagnosed, but they were actually in a supported living placement at the time they were diagnosed. So that's why that number went down, and supported living went up by 3 this week, even though we only added 2 people. Amongst provider staff, there have been 349 staff who have tested positive, including 4 this week. 30 of those work at more than one agency, and sadly, there have been 8 deaths among provider staff. There was a question regarding ResHab. Oh, I said host home. I'm very sorry. So 27 for ResHab. That is correct. So on the 27th, DC Health updated their guidance or issued new guidance regarding visitation, indoor visitation in intermediate care facilities. And they reviewed, so I'm just going to walk through this with people. This is posted on the mayor's website, coronavirus.dc.gov. I'll need to check to confirm that it's on our website. If it is not yet, it will be. We do post all the DC health guidance related to people supported by DDA on our website. So they are allowing for indoor visitation in intermediate care facilities. However, the very first provision is to clarify outdoor visitation is still preferred. And that's true in every instance. I mean, that's also true. It doesn't say it here. I'll just repeat it because it is important to keep this in mind, that it is preferred in a residential habilitation placement and supported living. For any of us, if we have people over to the house, we should have them in the backyard as opposed to, or, in some place outside, because being outside and maintaining appropriate physical distance and having face covering is the safest in terms of interacting with people. Any ICF that plans to have visitation, they must ensure that that no one who lives at the ICF at that time currently has coronavirus or any direct care staff. So there must not be any cases of COVID at the ICF for the 2 weeks prior to any visitation occurring amongst staff, visitors to the home, or people who live there. So there must not have been any outbreaks of any kind at the home in the 2 weeks prior to any visit occurring. And there must not currently be any people at the ICF who are under quarantine or isolation. So, if they have suspected coronavirus or if they have had a direct contact exposure with a person with coronavirus and are being quarantined, if someone in the home is being quarantined, the home should not have visitors in the home. And also the ICF must not be undergoing testing related to any outbreak. Lastly, the ICF should ensure that they have a 14-day supply of all the PPE that they would need should there be an outbreak related to the visit occurring. So they just need to make sure that they have on hand all the PPE they would need should they have a person test positive. Prior to initiating indoor visits, intermediate care facilities should notify families that indoor visitation is occurring at the ICF, and that notification should include the precautions that are being taken to ensure that the ICF remains safe and COVID-free, the expectations and the requirements for the visits occurring. At the very least, you should include a description of the screening process that's done when the people come so that they're clear about what's going to happen when they come, and all terms of indoor and outdoor visitation, including the requirement that people wear a mask, that they maintain social distancing, how to get in touch with staff if they need them while they're there, and what would cause a visitor to be denied entry should they arrive and an issue were raised in the screening process, as well as what steps the visitor should take before and upon arrival and during their visit. Things such as, everyone's required to wash their hands when they get there. They are screened. They need to confirm that they haven't, I'll go over those in a minute, but, that they're not currently required to be quarantining because they've been in one of the states that are identified on that list or that they've had contact with anyone. So just review, send something out that lets people know here are the conditions under which we can have visitation. So when indoor visitation begins, it should be limited to people who are able to comply with the requirement to wear a mask and to maintain social distancing. Keep in mind, masks are required for everyone, including the person that lives at the ICF when the visits are occurring. So when the visit occurs, everyone should have on a mask because the people visiting the ICF are not household members of the person at the intermediate care facility. if you recall, Daryl has reviewed this several times, reminding people that it is okay for people who live in an intermediate care facility not to have on a face covering, typically because amongst household members, we don't have to have that concern. But as soon as you introduce a guest, even if it's a family member, everyone must have on face covering because they are not household members. Only one visitor per person living at the ICF at one time. And given that they are indoor visits and that you're maintaining 6 feet of distance, I'm not sure that that's unreasonable, even in terms of space restrictions that exist. Make sure that people are not congregating in the area used for indoor visits. Require that visits be scheduled to make sure that the home can accommodate people when they want to come, so that people can't have drop-in visits. And the screening that occurs for visitors who come to the home needs to include a temperature check, a symptom screening, ensure that the person is symptom-free, fever-free, that they've had no known exposure to someone with COVID-19 in the past 14 days, and that visitors, you need to check to make sure that they have not been, that they have not had non-essential travel to a high-risk state. And you can get the list of high-risk states at coronavirus.dc.gov. It is updated weekly. It currently includes, I believe it's 30 states. It includes almost the entire United States, except for, I know Virginia and Maryland are not listed, and confirm that they have not traveled to a level 3 high-risk country outside the United States as well. There is guidance on the screening tool that can also be found at coronavirus.dc.gov. You need to make sure that the visitor has a face mask or cloth face covering that they can use, and make sure that it's one that's appropriate. We have had training for all for provider staff about what that means, but I see a lot of people with face coverings that have this this valve on the side that I always look at it and think, oh, that looks good because it won't fog up my glasses. It also will allow virus to escape the mask. So those face coverings that have that valve are not considered safe and should not be used. People can refer to the training that Michael Siegelman did for their staff, and I believe that training is also posted on our website. Ensure that the visitor washes their hands upon entry or does hand hygiene upon entering and exiting the home. Collect full names of any visitors that come and contact information, and keep that for 30 days to assist in the event there's any need for contact tracing. And of course, don't allow anyone who will not comply with all of the screening requirements should not come to a visit. During the visit, visitors need to wear a cloth face covering or face mask during the entire visit and maintain 6 feet of physical distance between people. There must be, and this was outlined in all of our guidance about visitation in any kind of place, that if you're going to visit inside, you should identify a designated area, and the visitor should just be in that area where, you know, they shouldn't be in walking around the home while they're there. And the person, as I said, who lives at the ICF must wear a cloth face covering at all times during the visit as well, keeping in mind that only a person who's able to remove a face covering should have a face covering on. And make sure that indoor visitation is occurring in a space that allows for adequate physical distance, that there's proper ventilation, and that at that time it's an isolated place so that the person and their visitor will be in the space on their own, that you don't have other people going in and out of that space other than, you know, needed staff. But other residents, other people that live in the home should not be an area that they need to use at the time. Visits should be limited to an hour. If the visit occurs in a person's room, it's important that just that person be there, not their roommate. And that the visit should not include things that will require removing the mask, such as having a meal with the person or drinking. After the visit is over, it is essential to make sure that you clean and disinfect the area where the visit occurred, or if it was in their room, the person's room, before their roommate's allowed to return. Any high touch surfaces in the home that could have, that were within the space of where they visited need to be cleaned, like light switches, for example. And, they also have a reference in here. Those high touch areas ought to be cleaned at least once every shift anyway. If there is an incidence of COVID exposure, visitors should notify they should be asked to notify, and they should notify the intermediate care facility staff if they develop symptoms or test positive for COVID within 14 days of their visit. And staff should also notify any visitors of any outbreaks at the home should they occur within 14 days of a visit, and recommend that the visitor seek testing. The exclusion is just visitors who cannot comply with face covering, social distancing, and other requirements cannot participate in indoor or outdoor visitation. I think that's pretty detailed, so I will see if there are questions about that. Someone posted all the states, I see. Keep in mind, that's the states today, and that should be updated. That is updated weekly. Please make sure that you're checking that as you are updating your screening protocol. Oh, okay. So there's a question here. The guidance says that restrictions on visitation do not apply to compassionate care situations and essential visitors or personnel as defined by the mayor's order. I'm trying to understand that question and how that sentence impacts the scope of the guidance. Does DDS understand the guidance to say that indoor visitation can occur in situations other than primarily compassionate care? Absolutely, yes. So that sentence regarding compassionate care, if I am not mistaken, let me find it real quickly. Yeah, so the restrictions that exist here, if you're considering the compassionate care exceptions to the visitation policy, you'd go back and look at the original policy, which identified, because you can then go visit with the person in their room. If a person has a visitor and, it's under that compassionate care exception, you certainly do not expect to have to put a mask on a person who's being visited in those circumstances. It's that kind of an issue. So as a follow-up, which I think is exactly understanding sort of where this is going, if a person living at an ICF cannot wear a mask because they cannot independently remove it, are they permitted to have indoor visitors? The way I read this, I would say no, and I will ask that DC Health clarify whether that's an accurate read of this. The concern they have is clearly when you're inside, the risk of transmission is greater. And so if you have a person who cannot wear a mask, visiting with them indoors is too great a risk. And so those visits should continue to occur outdoors unless it was compassionate care. That's how I read all of these together. And we will see if DC Health agrees with that interpretation.
Director Reese, if I can interrupt for a second. Can we just remind people to please send all comments and questions to the Everyone tab on the chat box so that everyone can receive the questions? Thank you.
So I don't see any other questions. So at this time, I'm going to ask Chanel and Crystal to provide an update regarding our IDD waiver renewal. There have been some questions about assistive technology and how that's going to work. I mentioned last week that we did not get all of the amendments that we sought. And so if Chanel and Crystal can describe how it works in what was approved by the Centers for Medicare and Medicaid Services.
Good afternoon, everyone. This is Chanel Parker. With the amendment that we got approved in the ISF waiver, we were able to include a list of allowable assistive technology items that were not previously included in our assistive technology service. I'll start with that, and then we'll go into provider qualifications and what services. There's 3 parts to assistive technology, and we'll talk about those 3 parts. But I just want to give you guys the list of items that are able to be purchased. Remotes and switches, service animals, mobile applications, smart home devices for completing activities of daily living, electronic motion sensor devices, door alarms, web cameras, telephones with modifications such as large numbers, telephones with flashing lights, phones equipped with picture buttons, programmed with that person's phone number, devices that may be affixed to a wheelchair or walker to send an alert when someone falls. This is different than what is available under PERS. Text-to-speech software, devices that enhance images for people with low vision, intercom systems, and other devices to enhance mobility and assist with performing daily tasks. So in order to receive assistive technology through the waiver, of course, you must exhaust the state plan, and then the service has to be recommended by the person's support team, or a physician's order could be given as well, but the physician's order is not necessary. So the type of professionals that can provide this service are your occupational therapist, your physical therapist, your speech and hearing language therapist, and assistive tech professionals who are certified through the Rehabilitation, Engineering, and Assistive Technology Society of North America, or another comparable national accreditation body. And then another provider type are your RSA vendors. Now, when it comes to the 3 parts of your assistive tech approval, once your team has recommended that you receive the service, you have to start with an assistive technology assessment. And during that assessment, there's a 4-hour comprehensive assessment done. And that is where they develop and implement your plan, the plan for assistive technology. And that assessment will also include the recommended assistive technology goods that you need to purchase. So once you've gone through your assessment, then you would receive a service authorization for the goods and services. And the goods and services are listed on the items I listed earlier, and they're also within the waiver amendment. Then there's the ongoing supports and services piece of assistive tech. That is your training and your technical assistance for the person providing unpaid supports for the person, or people who provide services to employ the person. So those are the 3 parts. And again, those are 3 separate service authorizations for assistive technology. We currently have a list of all of our providers on our website, and I'm going to put it in the chat box.
Thank you, Chanel.
Mm-hmm.
Andy, I also, hi, this is Crystal Thomas. I also wanted to just announce, and a press release is posted to our website as well as an announcement went out through our e-blast. So folks should have received, the announcement and reminder of our IFS, as well as the ID amendment being launched November 1st. So I wanted to highlight that.
We should also call people's attention, Kirk, to the guidance that we sent out today, because the turnaround time is very short. We just received this yesterday. We either sent it yesterday or today regarding registering for the related to the when vaccine becomes available. Kirk, can you speak to that a little bit? Because the deadline is like early next week. And as I say, we received it yesterday, so we got it out to you as soon as we saw it. But if you could speak to what was sent to people and what follow-up they ought to be taking.
Sure, Director Reese. So this is regarding, I just wanted to be clear, this is regarding the ICF participation in the Pharmacy Partnership for Long-Term Care Program?
Correct.
So yes, the email went out to ICF providers this morning, just kind of highlighting that the CDC has kind of clarified who is eligible to participate in the Pharmacy Partnership for Long-Term Care Program, which basically offers on-site COVID-19 vaccination services for residents of ICFs, nursing homes, and assisted living facilities when it is recommended for them in the future, hopefully in the near future. And so CMS basically posts this information to their website, as well as provide additional links for outreach for this particular program. And so providers should really, ICF providers should really read through what was sent this morning. If you have not received, if you're an ICF provider and did not receive an email from me this morning or from the QAPMA, Quality Assurance and Performance Management Administration email blast, please reach out to me directly. It's kirk.dobson@dc.gov, kirk.dobson@dc.gov, and I'll also post it into the chat box and I'll forward it to you. ICFs must be enrolled in the NHSN Long-Term Care Facility COVID-19 module to be eligible. So that information can be found at the CDC website, which I will also provide a link in below for all providers. So I just wanted to clarify. So currently, currently the CDC's guidance for the Pharmacy Partnership for Long-Term Care Program specifies it's only for assisted living and nursing facilities. However, it has been clarified that ICFs are also eligible. And so we encourage you to visit the website link that was sent below or look through the email that was forwarded this morning.
And to do so very soon, because if I'm not mistaken, isn't the deadline Monday?
It will close on November 2nd. So it is, yes, it is Monday. So I'm posting those links right now.
So does DDS have any advice or instruction on responses, preparation for possible civil unrest related to the election? No, to the extent that does go out, I expect that the mayor will send something out to all of us. I am aware, and this is, this was posted publicly. I know that a lot of streets around the White House on Tuesday will be closed. So access to streets, right downtown near the White House will be quite limited on Tuesday. I think we should all just be hoping for a very clear result and no unrest. So that's, what is the policy regarding a person wanting a home visit? So if a person wants to go on a visit, I mean, it depends. if we're talking about a person in an intermediate care facility versus other folks, as we've said, the limitations for people in intermediate care facilities are a bit different, but maybe someone can tell me if I'm wrong. I can't think of what kind of a limitation there would be. Keeping in mind, for example, if I live with 3 other people, or if I live with 1 other person, and I travel out to work every day, I, go out to dinner and eat inside restaurants, or if bars were open, I choose to go to the bar, or, I have a family reunion and I want to go to the family reunion. I think that those are the kinds of conversations that I would have with the people I live with, because while I am and should be free to make determinations about my own risk, when I come back home, there may be people who come to work there to support me, or who also live there with me, who have not made that same decision. And so there would then, as a household, there may need to be a discussion about that. I also think, like, if you're talking about a visit, like, the family's going to have a birthday party for someone, well, that would really concern me. But those are the kinds of things where there's a discussion, because it may be that you choose to go, but you're going to come home and quarantine for 2 weeks because, you've placed yourself potentially at risk, and you live with a person who doesn't want to be placed at risk. So all of those there isn't a policy saying you can do this, you can't do that. I have those numbers right here, 900 and some people who live in supported living placements. Many, if not most of those, are sharing a home with someone else. We have a little over 100 people who live in residential habilitation placements, where they're sharing a home with up to 4 people, in some instances 5 or 6. And then, of course, we have close to 300 people living in intermediate care facilities. And, when a person makes a decision like this, their decision has implications not just for themselves, but then for the other people that they come in contact with. And so, we can go back and revisit sort of the phase 2 reopening guidance, which speaks to the fact that people can go out, but at the same time, as people go out, they do need to be having discussions, because, in the instance where they live with another person, or where they have a staff person who's in their home every day, just having discussions about what will the implications for that person be. A staff person who sees someone go on out-of-town travel may decide that they need to use full PPE for 2 weeks. This person self-quarantines because they feel like they've put themselves at very high risk. And they'll talk through what the decisions of the people around you would be should you go on the visit. There is a comment here. Please vote, everyone. Because I do think an overwhelming result on that day, either way, will likely limit any potential unrest. That may be wishful thinking. But I think that this is everyone's opportunity. And let me just say, because I know I had this conversation about a week ago with someone who votes every single time, knows exactly where to go to vote, and is very committed to voting on election day because it's very important to this person to vote on election day. And I said, please make sure that you look at the Board of Elections website and identify where to vote this time, because the regular voting locations may not be available. So as we've all seen in regular, or at least I've seen anyway, commercials, plan your vote. So if you are someone who wants to vote on Tuesday because you're very committed to voting on election day, please make sure that you know where you're going to vote, because if you live in the District of Columbia, there are a certain number of voting sites where people can go. Oh, there was also, I had seen a question someone had regarding spending funds, the payment that people got from Social Security, and spending those funds. As people recall, you have a year to spend the funds. Some people say they've been hearing mixed messages about that. We have provided guidance to all the service coordination staff here. I think Winslow's met with all of them in their administration meetings to remind them. And so they do have that information. We'll remind them regularly that in terms of monitoring that, someone has a year to spend that $1,200 check.
We also received a question regarding PPE, and there is, I guess, an assumption or a thought that PPEs are starting to get scarce, and whether or not DDS is conveying a shortfall to DC Health on how to access PPE and coordinate it.
So we are not hearing from our providers, and our quality resource specialists are in regular contact with the providers. So if an individual provider is having an issue, they should let them know. There's not generally in our area a shortage of PPE. I've heard that on the news, concern about a shortage because we're seeing spikes in other parts of the country. But at this time, we are not hearing that there's a shortage of PPE. So if we did hear, we would make sure that the Health Emergency Preparation and Response Administration at DC Health were aware of this and was doing what was necessary to help support folks.
Director Reese, can I just jump in with an announcement for providers in the assistive technology service for a moment? So I just wanted to share some information that I received from the Director of the Healthcare Operations Administration, DHCF, on becoming an assistive technology provider. So to become an assistive technology provider in the under the IDD or IFS waiver, providers need to go into the PMDS system and designate that they would like to become and apply for the assistive technology service. That notification then comes through to us from the Maximus and Congruent Systems at DDS, and we'll review the application for all necessary qualifications and then approve or deny as necessary. So I just want to make that clear. To become an assistive technology provider, DHCF has advised that you go into the PMDS system and apply to become an approved assistive technology provider as part of the certification process of services you provide. Thank you, Director Reese.
I see that someone did post the DC Health guidance on ICFs and indoor visitation from the coronavirus website, coronavirus.dc.gov website that people can access. As I said, if it isn't there, it will be also on our website soon. So there's a question, the vaccination program does not apply to supported living or rehab. That is correct. In fact, the original guidance said nursing home and assisted living facility. And that's the reason we just got the guidance out now, is that we got, and maybe through advocacy on their part, clarification from the National Association of State Directors of Developmental Disability Services. We got word yesterday that that was intended to include intermediate care facilities as well. And the reason for that would be that people in intermediate care facilities are likely seen as at higher risk for serious outcomes. As people may be aware, as the district is developing a plan, a vaccination plan, and included in that is the priorities for vaccination, highest priority being essential healthcare employees. And then after that, it is people who are at highest risk. And so this is one way to make sure that people who live in intermediate care facilities would be able to quickly be able to have access to that vaccination. We will, of course, be following up with them about, how broadly you define people at highest risk and does that apply to other folks. But registering for this program is just for facilities, which includes just the intermediate care facilities.
Unknown caller.
Sorry about that.
So guess what? I'm leaving, Brad.
So will our staff be included as essential healthcare personnel? I think that we have often sort of pushed back on the idea, not that our staff are, our being provider staff are essential, but healthcare personnel, by the definition I've seen, have been people who provide care for people with COVID. When you look at the distinctions, we can ask DC Health when they're here next week, but I do not expect that initially our staff would be included in that. This is people who are actually sort of, in the hospital working with people who have COVID or in healthcare settings. And as that date gets closer, I'm quite certain that DC Health will send the appropriate staff to provide us the update on the district's plan, which is being developed by a committee that Dr. Nesbitt has brought together. So for clarification, as a day program providing virtual services, will we need to apply to become an assistive technology provider? Oh, no. I was trying to figure out the question, and I think I understand the question now, which is, because you're using technology to provide your service, does that qualify as a technology service provided to the person. No, the service you're providing to the person is whatever the service is. So, you may be providing, for example, supported employment remotely. And, that the person has a tablet, they could communicate with you through the tablet. And so, but that is not a technology service. The service is the supported employment. So no, you would not have to be a technology provider to do that, if I'm understanding that question correctly. The issue with the technology is that our waiver allows for the purchase of up to a certain amount of technology per year for a person or during the course of the waiver. And maybe Chanel can jump in and give me those specifics that I should remember and don't. And so technology purchased for the person would be included in that. That is, the limitation in the waiver is $10,000 over 5 years for purchase of technology. Are laptops, tablets, or desktops considered an approved AT in the waiver?
Hey, Morgan, Winslow copied and pasted the allowable items in the chat box, and I'm going to copy and paste them again so that you can see what's included for purchase.
So does a laptop or a tablet qualify under that whole list? I read the list.
Yeah,
I don't know.
If it enhances mobility or assists with performing daily tasks, then it would be included. That's why we left that last sentence there, because this is not an all-inclusive list. But if that laptop purchase assists someone with performing their daily tasks, then that would be approvable through the assistive technology.
Perfect. So if the tablet were used to facilitate that, then the tablet would be considered, correct?
Yes, correct.
Which would need to be determined by the interdisciplinary, like when they're developing the ISP and then an assessment done and then the equipment purchased.
Right. Yes, when they do the 4-hour comprehensive assessment, that's when they'll determine exactly what the piece of equipment that they will need. And it might not necessarily be a laptop. It might be a specific type of computer that's not a laptop, but that computer does certain things to assist the person with certain things.
So Morgan, my interpretation would be the most important item on that list is the last one, other devices to enhance mobility and assist with performing daily tasks. So I don't see any other questions. It's 5 of, so I'm certainly willing to wait the last 5 minutes. I hope everyone has a wonderful weekend. I hope that everyone either has already voted or goes out to vote on Tuesday. And we will be talking next week. So we'll just leave it live until 1 o'clock. And if people have questions, please feel free to type them in. But this time I know it's still live, so I won't continue talking until I've actually completely exited.
We also just learned that there's an additional assistive tech provider that was just added as of like 30 seconds ago. So just to give everyone an update and notice about an additional assistive tech provider.
So Chanel, there's a question. It says, who has the 4-hour required assessment required for AT? I assume you mean who provides that assessment?
The person who would provide the assessment would be an approved assistive tech assessment provider. So currently we have 2 or 3 now that we have an additional person. One of those 3 currently approved. And there, when you look in the drop-down box in MSAS, when the service is authorized, the provider, one of those 3 providers would provide the assessment.
It says, where do they get the assessment as we are going to apply? I assume that would depend on which provider was selected.
So there's a couple of questions in response to who has the 4-hour required assessment. So that's a clinical assessment from the selected provider. It's what Deputy Winslow reported. And is the $10,000 over 5 years include staff payment to service, train, and install technology? So,
Go
ahead, Chanel.
As mentioned before, as a 3-part of the, that's the goods and service is the 10,000, but the ongoing supports and services, which is training or technical assistance, that's a separate authorization, which provides, the technical training and any updates to the equipment.
So there's a last, so do OTs, PTs, and speech language professionals have this assessment as we are approved to provide this service and are going to apply? Where did the 3 providers obtain the document? So I guess what they're asking is, can you describe, the assistive technology assessment is the purview of the assessment provider, but maybe Chanel could speak more to that.
Correct.
Before Chanel speaks to that, if I could just jump in and say, so yes, so the qualifications include OTPTs and SLPs. I just wanted to make it clear that you have to still apply to be an AT provider in the PMDS system. So that's the first step before you start doing the assessments for individuals who need assistive technology. You just have to become approved provider of the service.
Correct. And then to follow up with what Kirk just said, each provider would have their own comprehensive assessment form for this service. So if you were asking, is there some like one standard form? It's a provider specific form, and it's a comprehensive assessment, and that's when they use the 4 hours to determine, you know, the service delivery method and the recommended assistive technology goods. And they also have to develop an assistive technology plan during that 4-hour assessment as well.
And I do see a note that the technology committee is working on a training to explain the process for assessments and service delivery. Thank you. Okay, have a great weekend, everyone. I will talk to you next Friday.